So, Dr. Adler, how did you get into dentistry?
When I was a teenager, I had to have braces much later than normal. So I was a senior in high school, freshman in college when I got braces, and I loved my orthodontist. And that was around the time when I had to decide what I was going to major in and what I was going to study. So I started taking pre-med, and I decided to become a dentist.
What's the most common procedure that you perform?
Crowns and fillings are the most common procedures we perform here, but we do also quite a bit of veneers and crowns and fillings are the most common procedures we perform here. Quite a few veneers, and otherwise all of the side things that we do, Invisalign.
What's your favorite procedure to perform?
Ooh, it's a hard one. I actually love them all because I get to switch around all day and makes my day much more interesting. I wouldn't want to do any one of them all day long, so I love that I get to do each one of them, at least once or twice a day, and then I can do something different.
What sets your practice apart from others?
Oh, well, don't get me started there. First of all, our office staff is just so lovely. We're all women here, and we just are a family, so I love coming here, and I think a lot of patients love that vibration about our office as well. And Adler Dental is just a warm, nurturing place where patients feel comfortable. We spend a lot of time with each patient. They don't feel rushed. We are very knowledgeable in all aspects of dentistry, so we can always help them with anything that they need, or at least advise them if it's something that we don't do. It's really just the vibe when you come here. That's really what sets us apart.
Okay. What can I expect during a dental checkup?
You will come in, the front desk will greet you warmly. You'll either fill out a form then, or you will have gotten it already online, so you already filled it out at home. One of our lovely hygienists, Susan or Michelle, will come and get you and take your full set of x-rays. They will clean your teeth thoroughly and check your teeth and gums. You'll get an oral cancer screening visually and with something called a Velscope that we have that is an extra tool that can help detect oral cancer much earlier than just the visual screening that we used to do. And that's part of the technology that we have here. We have a lot. We try to stay up to date with all of the state-of-the-art technology. And then the doctor will come in, either myself or Dr. Moed will come in and give you an exam, a thorough exam. And if you have any issues, we will tell them to you and explain it thoroughly. And if you don't, you come back in 6 months. And then you go to the front desk to make your next appointment.
What made you decide to open your own practice?
I worked at another practice when I first graduated, and I saw what I liked, saw what I didn't like, and I just felt that I could do it better. And so I just enjoyed the whole creation of everything here and learning, the business of it too. And I enjoy the dentistry, so that's why I have the great staff that I do, because they get to take care of the other stuff while I get to do the dentistry with no pressure from a boss telling me to produce more, make sure they have cavities, something like that, because I could never sleep at night with that. So I wanted to make sure that I was doing the ethical job, the right job with the right materials, and you can only do that in your own place.
What made you decide to offer Botox and fillers to your patients?
Oh, this is a great story. So, when Botox and fillers became an option for dentists, they started giving continuing education classes in it, and we take continuing education classes. I don't know if you know this, but dentists take 60 hours of continuing education every 3 years. And they started offering these classes, and I thought it was so fascinating, and I loved it. And as a dentist, we are uniquely qualified to do Botox and fillers because we study the muscles of the face intricately when we learn dentistry. So we know all about it. So this was just like a no-brainer to go and learn to do this stuff. And it's fun, and patients love it, and it's aesthetic, which is one of the things I love about dentistry in general. And now I get to do it on the whole face. And we also do Kybella here, which is if you have a little extra fullness, as they say, under your chin, and it gets rid of that permanently as well. So once I learned all of that stuff, it's just so interesting, and I love it, and it's really fun, and the patients love it.
What are some common mistakes people make in regards to their oral hygiene?
A common mistake is not flossing. A lot of people don't like to floss, but it really, brushing, I'll say, is 60% and flossing is 40%, because where your teeth meet, that little spot is where people get cavities, and that you can only really get to with a string going through. We do have something called a Waterpik water flosser that definitely helps with the gums, so that you might be able to get away with doing without flossing for your gums. But as far as for the cavities for the teeth, that little contact point where that floss clicks in and out, that spot is where a lot of people who get cavities get them. So that's a big mistake that people do with their oral hygiene.
Okay, so talking about flossing, you have kids, how did you instill in them it was important to floss and brush regularly?
I have to say, because I'm a dentist, I totally, when they were really small, I brushed their teeth for them, and it was really instilled in them that it had to be done every night and every morning, and I made it fun for them. I said, look in the mirror, see how clean it is, otherwise it's dirty in there, and we talked about the bugs that can be in your teeth, so that's how I helped them get into it, and then it just became a habit, like it should for everyone else.
How long is the typical wait time at Adler Dental?
I love this question because we do try to have very little to no wait. Obviously things happen, but because of the way we schedule, we never double book anyone, and we give everyone an hour. So there's always a buffer and a lag time for our staff to change over the room and make sure it's clean for the next patient, and that way the patients don't have to wait. Our waiting room is usually never ever full, except in between the hour when everyone shows up and they're sitting there for maybe, a few minutes.
Do you accept same-day appointments for emergencies?
We do, and we always try to fit them in, but as I just explained, we do honor everyone's time. So obviously we'll see you if you have an emergency, and the front desk will make sure that you can come here and not have to wait as long, but there may be a wait. But we do accept same-day emergencies, of course.
Are electric toothbrushes actually better than manual toothbrushes?
Electric toothbrushes are great. We actually sell the Sonicare here, mostly just to help out the patients. But if you know how to brush your teeth properly, you don't need to have an electric toothbrush. I personally don't use an electric toothbrush, and I've used one and then not used one. But you do have to brush for 2 minutes, and you do have to look in the mirror and make sure you hit every tooth on every surface. So the electric toothbrush has a timer. Make sure you do it long enough. It has a diagram, and if you follow the instructions, you will hit it all. Plus, I do think that people feel, and I did too in the past, that you feel like you just got a cleaning. I would say they're equal if you are really diligent about the way you brush your teeth.
And finally, what toothpaste would you recommend your patients use?
Any toothpaste that has fluoride in it. I know there is some people who are very organic and they don't want to use fluoride toothpastes like Tom's, but I highly recommend the fluoride toothpaste because I've had patients come, decide to go, more natural, use a different toothpaste that doesn't have fluoride in it, and 2 years later, they come here and they have a whole bunch of cavities. I've had that happen a number of times. So I'm all for, organic. We don't use silver fillings in our office, which has the mercury in it. But as far as the fluoride, I'm a stickler for the fluoride.
Wow, Dr. Adler, that's super interesting background. Thank you so much for your time. When can everyone find you? Where can everyone find you?
Well, we are online. You can look us up on adlerdental.com. Our phone number is 212-685-7765. We're also on YouTube, Facebook, Instagram, Snapchat, and Twitter. So we're all over the internet, so you can see a lot of information about me, Dr. Mowat, our staff, and you can get all the information you need before you come in. And I promise we will take great care of you.